Welcome back to Greatness Unlocked. I appreciate you deciding to spend your time with me today. If you find any value here, I humbly ask that you hit the like and subscribe. The Journey of Semen Retention, a 6-month reflection. Gentlemen, today I want to take you on a journey that many embark upon, often filled with speculation, anecdotal claims, and a variety of personal experiences. I'm talking about the practice of semen retention, a commitment to abstaining from ejaculation for an extended period, in this case, 6 months. While this topic can evoke a mix of curiosity and skepticism, it's essential to approach it with both an open mind and a critical eye. The experience of practicing semen retention for 6 months can vary significantly from person to person, and the effects can be both physical and psychological. Here are some potential outcomes that individuals might encounter after this period. Mood changes. Some individuals might experience mood swings, anxiety, or frustration related to the practice. The challenge of abstaining may lead to feelings of guilt or shame for those who struggle with the concept of ejaculation, particularly influenced by cultural or religious beliefs. Attraction and respect. Anecdotal evidence suggests that some practitioners feel they receive more respect and attraction from others, possibly due to increased confidence or a perceived shift in energy. Now, let's talk about fertility. Research indicates that prolonged ejaculatory abstinence beyond 4 days can actually have negative implications for sperm quality and motility. For couples trying to conceive, frequent ejaculation is generally recommended, often every 1 to 2 days, to optimize fertility. This is where the anecdotal claims of increased vitality and enhanced focus can clash with medical facts. Sperm quality. Prolonged abstinence can impact sperm quality negatively. While the body reabsorbs sperm, extended periods without ejaculation might affect motility and overall sperm health. And then there's the question of testosterone levels. It's been suggested that short-term abstinence, up to 3 weeks, might lead to a temporary spike in testosterone. However, these levels tend to normalize soon after, with no lasting benefits from long-term retention. So, while some might feel a surge of confidence and energy, it's essential to recognize that these feelings might not stem from a biological advantage. Enhanced self-control. The discipline involved in practicing semen retention may foster a greater sense of self-control and mindfulness in other areas of life. Increased focus and discipline. Many who practice semen retention report enhanced mental clarity, improved focus, and a sense of discipline. This could stem from the conscious effort to control impulses and redirect energy toward other pursuits. Let's not overlook the potential risks associated with this practice. While many individuals report feeling great discipline and control, prolonged semen retention can lead to discomfort. Some may experience what's commonly known as blue balls or epididymal hypertension, a temporary, harmless ache in the testicles that arises from extended arousal without release. Changes in relationships. The impact of semen retention on interpersonal relationships can vary. Some individuals may feel more confident and assertive, potentially improving their social interactions, while others might struggle with intimacy due to the abstinence. Moreover, we must address the emotional and psychological dimensions of this journey. For some, the pressure to retain can lead to anxiety, frustration, or even feelings of guilt and shame surrounding natural bodily functions. This psychological burden can have real implications for mental health, echoing concerns similar to those seen in conditions like DAT syndrome, particularly in cultures where ejaculation is heavily stigmatized. Energy levels. Some individuals report increased energy and vitality during the retention period, possibly due to heightened focus and motivation. However, these effects can be subjective and may not be universally experienced. Now let's take a moment to explore the anecdotal claims made by those who practice semen retention. Over a 6-month period, some individuals report experiencing a range of benefits: heightened energy levels, enhanced creativity, clearer skin, and even a deeper voice. Mentally, they might feel improved focus, increased motivation, and greater confidence. Spiritually, some may feel they have tapped into a deeper sense of self-control and purpose. Testosterone levels. As previously mentioned, short-term abstinence may lead to a temporary spike in testosterone, but long-term retention does not necessarily sustain elevated levels. After 6 months, individuals may find their testosterone levels returning to baseline. Interestingly, many practitioners also claim to observe a shift in how others perceive them: more respect, increased attraction, and a greater sense of masculinity. These personal anecdotes can indeed be compelling, yet they remain subjective and unverified by scientific inquiry. Self-discovery. For many, the practice can lead to introspection and personal growth. Individuals might explore deeper questions about their desires, values, and purpose in life. For those who turn to spiritual texts for guidance, verses from the Bible, such as those that speak against spilling your seed, often resonate deeply. Passages like Genesis 38:9-10, where Onan is punished for his disobedience, emphasize the weight some believers place on the act of ejaculation. This spiritual perspective can add layers of meaning to the practice, intertwining it with notions of discipline and moral conduct. Sense of accomplishment. Successfully maintaining the practice for 6 months can lead to a sense of achievement and empowerment. This might bolster confidence and self-esteem for some individuals. Yet, it's important to acknowledge that while the practice of semen retention may offer some individuals a sense of control, discipline, and even temporary feelings of increased energy, these experiences do not equate to empirically backed health benefits. Yet, the act of retention and the level of focus, consistency, discipline, and willpower it takes to be successful, and it should be a strong reason for you to choose this path. In conclusion, as we reflect on the journey of semen retention over 6 months, let us remember to approach it with a balanced mindset. It can be a personal exploration filled with lessons about self-discipline and self-awareness, but it should not be mistaken for a panacea for all of life's challenges. Embrace the journey, but remain grounded in reality. Seek evidence-based practices for health and well-being, and always listen to your body. Ultimately, The path to understanding oneself is multifaceted, and each individual's journey will be unique. Thank you